Jason Campopiano. I'm a physical therapist in an outpatient clinic who specializes in neck and back pain. I'm certified in McKenzie approach to back and neck pain. I'm here to give you some tips today to help you get more out of your day and allow you to get some pain relief and hopefully avoid any significant problems. I found in my practice that many neck and back pain that we see is caused by improper body mechanics and, more importantly, improper ergonomics and postural imbalances. People typically get themselves into a position of forward bending, forward flexion throughout the day, which causes a significant amount of back and neck pain. Let me give you some tips. One of the most important things with your positioning during the day is to think about how you can position your spine in a manner that is going to increase the lordosis of the lower spine. When we talk about the lordosis, we're talking about the curve in the hollow of your back. What we find is that the more that people get into a slouched position, getting into this type of forward-leaning position, the more stress and strain that's put on the lower part of the spine. A method that we use frequently at the clinic is to incorporate a small lumbar roll into the chair that people are using. Something along the lines of a small pillow or a rolled up towel to be placed right at the hollow of the back while you're sitting. It puts you into this more upright position, taking pressure off of the lower spine and allowing your head to be in a more neutral position. When one is sitting at the computer during the day, you should pay attention to having your knees at approximately a 90-degree angle and having your hips and spine also at a 90-degree angle, facing the computer directly so that the screen is straight in line, sometimes placing a small box underneath the monitor so that your eyes are directly looking at the screen. Very frequently we get into this position of a forward head where you're craning forward, causes a significant strain on the mid and lower neck. So we're going to position the monitor straight ahead. We're also looking at approximately 90 degrees with the shoulders and elbows. The important thing to consider during the day is to also increase the lordosis of the neck. We typically do that by slightly retracting the spine, going into an extended position, and returning. This motion should not be painful. You should feel a bit of a strain as you go all the way back, but that should pass as soon as you return to normal. This is going to realign the bones in a manner that that places you in a neutral spine and takes the pressure off of the nerves in the neck. Another thing to consider with proper care of your back and spine is every 1 to 2 hours you should be getting up and doing some extension exercises. We spend a lot of the day in this flexed position, so to take that pressure off the back, we stand, get away from our chairs, hands in the small of the back, extend backwards till you feel that stretch in the small of the spine, and do that repeatedly. You do not have to hold this. You simply extend, arch, and relax. We just do pressure on and pressure off. 10 to 15 times every 1 to 2 hours is going to help tremendously to take the pressure of sitting off of your back, your spine, your buttocks, the entire area. With the middle spine, which people have a tremendous problem with getting into this forward shoulder position, taking a small ball, soccer ball, or some small pillow, putting that right in the middle of the shoulder blades, arching back over the ball, providing pressure forward as you're pushing back, pulling yourself backwards. Again, 10 to 15 times every 1 to 2 hours. Also trying hands behind the neck, pointing the elbows up towards the ceiling and arching back. Tremendous for relieving pressure, strain, stress in that middle part of the spine, and get you out of that computer posture. And that's what people just fall into all the time, and we want to try to take the pressure off of this entire area.